This time of year, West Nile virus is a particular concern, particularly because the mosquito population is so great. I will emphasize to you that West Nile virus is a viral infection, and so there is limited treatment available. The good thing is that most people, 80% of people who are infected with West Nile virus, will be completely asymptomatic. That means that they won't be sick at all. 20% of the people who are infected will have a mild viral illness characterized with fever, body aches, rash, joint pain, perhaps some nausea and vomiting. But 1 in 150 of those people will have the most severe form, the neuroinvasive form. And in this form, the virus invades the covering of the brains called the meninges, causing severe meningitis, which is characterized by a severe headache, neck stiffness, and fever, or it can progress into the brain itself, causing an encephalitis. This form can last for quite a long time, can potentially be lethal, and can leave lasting neurologic effects that will continue throughout the lifetime. Making the diagnosis of West Nile virus is difficult and challenging for the physicians. First, the symptoms have to have occurred for approximately 8 days before any kind of testing will even find the virus. And then the testing is really not perfect. A positive test is positive, but if there's a negative test, that does not prove that there's not an infection. The people who are at most risk for West Nile virus are the extremes of age, the very young, the very old, and people who are immunocompromised, either by virtue of a disease process such as diabetes or hypertension, or immunocompromised because of chemotherapy drugs after cancer, or HIV infection. If you suspect that you have West Nile virus and you're having severe symptoms, it's advisable to see a healthcare provider. In some cases, you may need hospitalization for intravenous fluids, fever control, and pain management. The most important thing that you can do is prevention. There is no vaccine to fight West Nile virus, and so preventing the mosquito bite is most important. There are government efforts through the Mosquito Abatement Organization to try and keep mosquito populations down, but there are things that people can do themselves. You should walk around your home and empty any standing water where mosquitoes may breed. Fight the bite. Stay out of the outsides from dusk to dawn. Use mosquito repellent with DEET and wear long sleeves and long pants and tip over any standing water.